Swayam Prabha. Digital India. Educated India.
An innovator named Mahima Mishra has come up with a cost-efficient aerosol device that can be used in the external region of the oral cavity and is called as Aerovacuator.
Innovation in each and every sector is proving to be a real game changer. With changing times, we require advancement and unique solution in every walk of life. Innovation in health can enable breakthrough performance, and our young minds are leaving no stone unturned to change the dynamics and make a difference. So, in today's edition of Changemakers, we have with us one such innovator who has brought up one novel technology in the healthcare sector. Let us welcome Mahima Mishra. Hello Mahima.
Hello.
Mahima, please introduce yourself and tell us briefly about your innovation.
Hi, I'm Dr. Mahima Mishra. I am from Siliguri, West Bengal, and I started my undergraduation in Mangalore. I did my BDS in Manipal College of Dental Sciences, Mangalore. And right now I'm pursuing my Masters of Dental Surgery in MCOT, which is situated in Manipal, very close by to Udupi in Karnataka. So in 2020, during the pandemic, I identified the problem of dental aerosols which were infectious, because of which the dental clinics were shut down. So I tried to find out who was the culprit, why is this happening? So after doing a lot of research, I got to know that these dental aerosols are basically small water droplets which are created during the dental procedures. So the instruments which we use, those instruments, they release those spray-like particles. They mix with the patient's spit, that is the saliva, and they create small droplet-like particles which are coated with infectious agents. So just consider that a patient who is coming to your clinic with tuberculosis. So these patients, they will be releasing those bacteria in their saliva, and that will mix with the spray which is released from our instrument, and they can form droplets which stay suspended in the air. So for example, a next patient who is fine, they come to the clinic, they get infected with the same disease. So the problem during COVID was like, it was an infectious disease and we had to get rid of it. So that's where the idea came of. Dental aerosol has been prevalent since years, but it was not that deadly and people were not aware of it. But during COVID, we realized its importance. That's when I realized we needed a solution to capture the dental aerosol particles and evacuate it out of the clinic. So with that, I developed a device which is known as Aerovacuator, which is an extraoral dental aerosol evacuator. It is kept 15 centimeters away from the patient's mouth. So the moment the aerosols are generated, it is captured by the suction hood which is placed here. It is conveyed via a pipe into a chamber in which the filtration happens. So whatever aerosol is captured by that suction hood, it is filtered by the chamber which is present, and then it is evacuated out of the dental clinic. So in this way, it renders the dental clinic free of any infectious agent. So that is what my innovation was.
Yeah, thank you for introducing yourself and providing an overview of your innovation. So it is evident that your innovation has potential to make significant impact in the healthcare sector, and we are excited to learn more about it. So Mahima, can you just brief what problem you are addressing through your innovation? Please elaborate on that.
Yeah. So basically the dental aerosol particles, as I mentioned, is very infectious. So if any of the patients who are coming to the clinic, not just tuberculosis or COVID, it could be any other disease which could be like influenza. So the next patient who is coming, they will get infected, and ultimately we are affecting our society in that way. So it's very infectious for the patients per se, because the doctors, they are still wearing PPE kit and they are very safe. But dentists, the patients, they really need to be safe. So the problem I'm solving is preventing the patients who are coming for dental treatment from getting infected from those infectious diseases.
Really, it is one of the important problem you are addressing through your innovation. And Mahima, what was your source of motivation for this innovation, and who inspired you to do something like this?
Okay, so like I said, during the pandemic, I realized this was the issue. So I was doing my internship, and we were all sent back home. So when I was in my home, first 3 weeks of the pandemic, I felt really good. No college, no hospital, nothing, and it was really nice. But after a month, I started missing my dental instruments, that environment. So I realized there was a problem which is there. I wanted to go back to the clinic and start working. And the worst thing was when the patients started calling me, all my relatives, they started calling me, hey, I have a toothache. Hey, I have this issue, but I'm not able to go to the dental clinic. Please tell me if it is safe to go. And I felt so helpless because some things can't be solved with the medicine. We have to go to the clinic, get the filling done, get the root canal done, get the cleaning done. And 6 months, I can't tell you how bad the oral hygiene for people have become now because they could not visit the dental clinic. Even for a year, they were so scared they did not go. So I realized there was something which was needed to help these people. People are having health issues, they can still take, if they're having fever, they can take a tablet, they can get rid of it. They have pain, they can get rid of it. But dental issue is something, if it is existing, we can't give them just tablets and get rid of it. It will first be persistent and it will be there. So I realized there was a need for a solution and nobody was looking into it. Everybody was asked to shut down the clinic. Then I figured out it is because the government regulations were not followed all these years. The government regulations, that is the thing which has been given up by WHO and Center for Disease Control, they have specified very clearly that an HVAC system, that is high volume AC or an air conditioner, air ventilation system is a must in a dental clinic to prevent these infectious agents. Across the world, very few clinics had these. So whoever had these standards, they were allowed to function. Most of the clinics did not have, so they were literally asked to shut down. So the problem was people were not having. I then did further research and I figured that people were not using these available devices because they were very costly. The second problem was they were very noisy and they were not that effective, and people didn't realize the need for it. So I started with my innovation to make sure that patients get relieved, and even the dentists who are not using this, they need to get educated that how important it is and how their problems I can solve. So I picked up their pain points. They were facing issues with the high volume suction, that it was not efficient. There was noise which was not getting resolved. So I started working on it. Being a dentist, I knew what are the problems. I interacted with my colleagues who were dentists, my professors, and I figured out what the real issue was. And being a dentist, I could understand the issue. I could sit in that position and understand how I can resolve this, which an engineer or a company who is making dental products, they can't understand because they have not been in that shoe. But being in the same position, I could get the pain points. I worked on it, and today I'm in a situation where I can actually take my market to the product with few more iterations.
Yeah, great, Mahima. It's impressive how your personal experience during COVID and observations have led you to develop a solution that has a potential to create a significant impact. Mahima, can you tell me the challenges in this journey and how you overcame this?
So the major challenge I would tell you is when I started it off, I was a normal dentist, like a dental student, and I had never been exposed to these kind of situations where you go into innovation, entrepreneurship. And I am from a background where my elder brother is also a doctor, my younger sister is a lawyer, so there were no engineers in the family. So I knew there was a problem. This was the problem, dental aerosol, and I knew I had to solve it. So how do I solve it? My mind was working like I need to capture it and I have to throw it. That's how it was working. So I came up with the idea. I just told my father about the same. And he said, why don't you go and approach your physics teachers who have been there in the school? They can tell you how it is. Then I interacted with a lot of people and I figured out maybe the diameter is not enough for the suction. I don't know how to do it. So I was just picking up things like vacuum cleaner from my house, putting in the pipes in the house because it was during peak COVID time in April when I came up with this idea. So I didn't even have access to the market where I can get the welding done, all the drilling done. So being a dentist and healing from a background where all doctors and lawyers are there, I was not able to identify engineers to help me with this. So this was where my challenge started. And then I came up, I was constantly fighting and trying to figure out, I have this problem, I have to solve this. So I have to find a solution. So I was running around and finding people. So who supported me with this journey was Dr. Arun Chandra, who was there in Innovation Center. He was the Chief Innovation Officer. So I approached him through Instagram and I just shared my idea. It would be a stupid idea and I never thought I would go ahead with it like for such a long journey. My only thing was I have to get a solution and tell it to the people who will do it and get it done. I had no idea about patent, to be very honest. That I can get a patent for this and all those big things. I had no idea. So I approached the right person, I feel, and that's what helped me in my journey. I shared my idea with him and he really liked it. And being in that area of that field, he knew what has to be done. So he guided me, and since he was the Chief Innovation Officer, he had ideas about what are the upcoming challenges. And since our institute, MAHE, is associated with the Institutions Innovation Council, so sir asked me to apply for a challenge which was in a local area. So it was only restricted to MAHE. So that was known as Manipal COVID Challenge. He told me like baby steps, do this. So I applied for the Manipal COVID Challenge and I won that competition. So after that, he could see that I have the potential of taking this little ahead. So he told me there's an innovation contest, national innovation contest that has come up to us. Apply for it. And to be very honest, the form which we filled, it was so expensive. I was pretty scared, but I filled it up. And I submitted, and that's how my journey actually began. After I cleared the first round, I got some kind of mentorship from the National Innovation Contest mentors. They would come up and tell us how to make a pitch deck. And the nightmare which I faced was the financial projection which we had to make. I used to hate maths and I did not opt for mathematics after 10th standard. So I had no idea about accounts, how to work with Excel, the PowerPoint, but the kind of mentorship which I received from Ministry of Education's MIC, it was great. So every step I just kept following the steps, just doing the tasks which were given to me, and by doing that, it took me, I think it took us about 1.5 years to go to a stage where we would get a funding. So until then, I was just fighting hard. So the toughest part for me was being a dentist, not knowing any engineering, not knowing anything about computers, and getting all of these things together and coming up with a product. So I faced a lot of challenges in that, identifying the right person and getting everything in place. So that was my biggest challenge that I faced.
It's clear that your journey has had its fair share of challenges. Overcoming these obstacles requires resilience and adaptability, and it's evident that you possess those qualities. Your ability to seek guidance, conduct research, and iterate your approach shows your commitment to finding solutions and making progress. Your determination and perseverance are admirable. Mahima, recently we have seen many innovations in health sector. So how is your innovation unique from all others?
The most of the innovations that you will see that are there in the market, they are mostly medical products. If we come to the dental products, most of them are made by the engineers. So what I feel how ours is different is we interact with the dentist. We go and talk to them. Me being a dentist, I identify the problems, and it's not just one innovation that I'm looking into. I have come up with other ideas as well. So I'm trying to identify the pain points from our dental clinic and I'm trying to address them. And I go directly to the target customers who are the dentists, and having a rapport with them helps me a lot in making the product better. So that's where we just don't go ahead and start something new. If there's a problem which is existing and a product is there, but the product is just lying, people are not using like one of these extraoral suction devices. So we identify why are they not using it, and we try to address those points. So that's where we actually stand different from the other products in the market.
Really, it's good to hear from you. And Mahima, please share your experience while participating in National Innovation Contest organized by Ministry of Education's Innovation Cell.
So the competition which I have been since 2020, the National Innovation Contest, it has been very motivating and it has helped me a lot. Like I mentioned, right from working on PowerPoints to Excel sheets. I had no idea about any of these, how to maintain my bills, how to maintain my accounts, how to find the right person, what are the stages of product development. We knew nothing, like from idea to POC to prototyping. You all have guided us at every stage, and having received mentorship from Deepan sir, and also the way Abhishek sir is continuously active and helping us at each and every step, the way you all organize the Azadi Ka Mahotsav event in Bangalore in last year, August. So that was also very helpful for us because we learned to go on the stage, talk about the product in a public environment, and we got a lot of feedback. Not just that, recently the Pragati Maidan event which was organized, that was very helpful because we could interact, like challenge which I said, I was not able to get the right set of engineers. So after coming for this event, I figured out people who are working into these sectors, someone who is working with filters, someone who is working with vacuum pumps, someone who is an expertise in design and development. So we could get in touch with all these people, and not just that, we received, we kind of gained confidence by going and pitching before the investors. So the kind of exposure we have received over the period of time from Ministry of Education's MIT Innovation Cell, we have literally become from nothing to something today, and I just hope and pray that we become everything in future. So we have received a great support, and very thankful to AICT's Ministry of Innovation Cell for the same.
Mahima, it was very happy to listen from you about the National Innovation Contest. This platform offered you invaluable opportunities for recognition, exposure and networking. The interaction with fellow innovators, experts and potential collaborators can lead to new insights and collaborations, further fueling your innovation journey. Mahima, how do you ensure that your product meets quality standards?
So ma'am, there are a lot of standards, like we have to follow the FDI approval, not just that, the ADA standards. So we have to look into those standards which are labeled, the certifications, the licensing, we have to follow that. What are the WHO guidelines? Based on that, we can make our own set of guidelines for the same product, and we can go ahead with testing and certification to make sure it is as per the industry standards.
Great. Ensuring quality standards is crucial for any innovative product, and please prioritize these aspects and you will have a great success ahead. And Mahima, how cost effective and readily available is your product to the end user?
So our end users are dentists who are practicing in private clinics. So what we are trying to do is, right now it's still in the development stage. So we have our marketing and market to go strategy ready, in which we will be targeting the dentists, and we will be trying to provide the product as cost effective as possible. We are trying to keep the product cost least so that for easy adaptability. Right now, it is not a need. People are not understanding how harmful these viruses or bacteria can be, because the patients are getting affected and they go ahead and they don't even report back because they are unaware that they are picking up the infection from the dental clinic. They think, okay, it must have come through someone else. So we have to target our population as patients as well. We have to educate our patients to go ahead and look for clinics where these devices are available. And on the other side, we have to educate our dentists as well and provide it as a very good price so that they can easily adapt it. So that is our plan, to work on both ends, the dentists as well as the patients, and make sure that they easily adopt these new technologies. So initially we might keep the cost very low so that people understand its importance, and later on, based on the additional features, we might increase the price. But right now we are just trying to provide some device which can do the functionality, not just something which can be a hi-fi device with a touch screen and everything, because that would shoot up the price and people are not readily accepting that device as of now because they don't feel the need. So our main aim is to make people understand the need of the device. So that is our plan initially.
Yes, great, Mahima. You have to, you are addressing one of the important issue. So please focus on cost effectiveness and also the usability of the product. It should be user friendly for the doctors as well. So focus on that aspects. And Mahima, have you received support from other sources as well, like financial or any other support?
Yeah. So initially, when I started the product development, before I got NIC funds, I needed some funding to develop the POC and the prototype. So Innovation Center Mahe has completely supported me with that, and even the patent application. I did not have enough as a student to go ahead and apply for the patent, so they have provided me with a lawyer from their end who helped me with the patent filing, and even the cost was borne by the institute itself. Other than that, any funding support which I needed as a student here, they have always supported me with that. And other than that, I also applied for the Nidhi EIR fellowship right after that, because I knew I needed more funding to develop the product. So I needed some amount to pay the engineers and get the raw materials. So I applied for Nidhi EIR fellowship, which I did at the Mutvi Manipal, and I was granted that. So for a year, I was working on my product with that funding. Once that got over, I received the NIC funding from Ministry of Education's MIC. So with that funding, I have been developing the product. Other than that, I have constantly applied for other ideas at other events, some international events, and whatever amount I used to get as prize money, I have been trying to utilize that to focus on my main product. So I'm trying to build my product with these sources.
Yeah, good to know that you are receiving a lot of support from others, and you have patented technology as well. Surely you will attract the investors in future as well. And Mahima, if you have to give one piece of advice to the youngsters who are thinking of starting a venture, what would that be?
I would like to say that in innovation or entrepreneurship, it is basically riding a bike. Okay, so when you ride a bike, you have to give a kickstart if you have been constantly keeping it in your parking. So that's how we are. We have been trained to go to school, do the homework, come back. So we are on that standby mode as of now. So to kickstart your journey, you need a kickstart, and once you do that, if you have any idea, anything in mind, and you know you can resolve it, just go ahead. That's my one advice. Number one is go ahead. Don't be scared. I never knew I would be here today if I wouldn't have approached my advisor. Even though I thought it was a stupid idea, I would have just kept it behind. I would not have shared with my dad. I would not have gone ahead and shared with my advisor. So one step is I realized you have to just go ahead, apply, talk to people, share your ideas, go to the right person who will approve your idea if it is right, and if it is not, who will tell you, who will not be scared to tell you that it is a stupid idea, you can think of something else. So just go ahead, identify the right people, and just like I said, riding a bike, once you kickstart and you start riding, you will face a lot of bumps on the way. So you have to not be like, okay, yeah, I give up, I'll stop, break up like, yeah, I'll stop. It is not going to happen. You will face a lot of roadblocks. You need to find your way out. So that's what Red Mountain, that's my company name. Why I kept the name Red Mountain is what everyone asks. So what I want to tell you is what I realized throughout my journey till now, and I'm still facing, is a lot of roadblocks, a lot of failures, a lot of things which will pull you down. But what keeps me going is I know that when I reach that top of the mountain, the view from the top, the sunset, the red, orangish hue will be worth it. So that's what keeps me motivating. So don't be scared of the roadblocks. Face them as a challenge. You might be having 3 problems at a time. Just think that those are new challenges. Accept them, solve them. Don't be disheartened if it does not work out. Move on to the next idea. Don't fall in love with your ideas, because some ideas, they're just good in our head, but when we take it to the market, it does not work out. So main thing about an innovation is you have to go and talk to your target customers. You have to talk. You have, even no matter how shabby your product is, you have to go and talk to your customers, take their feedback, and if it is a stupid idea, move on. Since you had a bad idea, just remember that you will be having more ideas in future. You are not restricted to one idea. So don't be disheartened. Give up that idea, move to the next, and luck again. So it's just like once you find your right way, you will get the right way. And to be very honest, right now, we have so many support systems, like the government is providing so many grants, so many funding. You just need to identify the right source. This is not even a barrier now to not get funds. And once you apply for a company as well, you open your company. Even then, we have Startup India who provides so many privileges. So don't be scared. Just start with your idea. Go ahead. You will find the right way. That's what I would like to say. That you have to start. That's the main thing. Just give a kickstart to your ideas, and it will definitely take you towards the journey of entrepreneurship. That's all I have to say.
Yes, Mahima, it's really interesting to know the logic behind your Red Mountain, the startup name. So great. So your advice for aspiring young entrepreneurs is invaluable, encouraging them to believe in their ideas, be persistent, seek mentorship, and embrace challenges, demonstrate the importance of resilience and continuous learning. Your advice highlights the qualities required to embark on an entrepreneurial journey successfully, and all the very best for your startup as well. Mahima, what plans
So much.
what plans do you have for the future of your business?
So right now I am doing part-time business and part-time I'm taking care of my studies, and it's getting a little difficult, so I'm not able to focus completely. But as soon as I complete my MBS, because I realized doing an MBS was an essential thing, because I'm working in this area itself, dental healthcare. So completing my education, MBS is the highest degree that I could get. So I wanted a good education, good knowledge about my field, and only then go ahead with my entrepreneurship, which is a specialization of healthcare dentistry. So I wanted to complete my education. So it's just a year ahead, and once I complete my MBS, I'll be doing full time. I'll be working on my Red Mountain company, and I want to go ahead and solve other issues and take this ahead. So my main focus in future will be my business itself, and other than that, I will definitely do some kind of practice, maybe few hours a day, to make sure my journey is constantly, I can find new ideas, new problems, and I'm eager at solving them. So that's my plan ahead, to get over with my studies, and I have been applying for some funding as well. So if I get some investment, it will be easy for me to go ahead, hire people, and get things sorted. So that's my plan, to raise fundings in future and take my journey ahead.
Yeah, great. It's fascinating to hear about your plans for the future of your business. So you are focusing on growth, expansion, and future enhancing the reach and impact your innovation demonstrate your long-term vision. We wish you all the best from Ministry of Education's Innovation Cell. And Mahima, do you have a vision for the betterment of our country through this innovation of yours?
Definitely, if an individual is healthy, if the person who's coming to our clinic and they are healthy, they will make sure that they don't spread the infection to the rest of the community, and in that way we are definitely going to make sure that our entire country is healthy, and definitely that will impact the world as well. We will not lead to another pandemic, I hope, if we take care of minute things as preventing spread of infection. So that's where I wanted to start from. So I want to make sure that everyone in the world is healthy, as healthy as possible, by not ignoring or being careless about these small things.
So you want our entire society to be healthy. Thank you for this one, and your story will undoubtedly resonate with our audience and serve as an inspiration for others who are embarking on their own entrepreneurial journeys. Wishing you continued success in all your future endeavors. Thank you for being a true innovator and making a difference in the world. Thank you, Mahima. So that's all from us in this today's edition of Changemakers. But keep watching for some more such inspiring stories. Till then, keep ideating and keep innovating. Thank you.